Hi, my name is Greg Fell. I'm Director of Public Health Sheffield. This is Epidemiology and Situation Report for COVID of the 24th of January. Firstly, epidemiology. The 7-day rate is falling pretty rapidly across the whole of Yorkshire and definitely in Sheffield now, and has been for about the last week. Signs that it's beginning to flatline. So it kind of went up steeply, it's come down very steeply, and is now beginning to flatline at sort of a new cruising altitude. That cruising altitude is high. It's about 1,000 per 100,000 people over a 7-day, or 1% of the population in any given week testing positive. That's 3, maybe more times higher than the cruising altitude for Delta, and many more times higher than the cruising altitude for all of the variants that preceded. And it's worth noting that that's those who test. Probably only about half of people who have the illness actually get tested. So still high cruising altitude for some time to come, but I do think that will settle into the spring and into the summer. It remains to be seen how that develops. The virus itself will continue to evolve. We've seen what Omicron can do, and there will be further mutations of that, and it's impossible to predict how that will go. The impact of the virus may become less and less. Certainly Omicron led to a milder illness, but lots and lots more people had it. It remains to be seen with the impact of the future iterations of the virus, and we will watch that space with interest. So as of this Thursday coming, the government have recommended that most Plan B restrictions, such as COVID passports for large venues, mask wearing and working from home, should be lifted. Many people will welcome that. It's fair to say that there are plenty, including World Health Organization, that argue that the UK has moved too quickly. It remains to be seen what will happen. I think there are three groups of people largely. There's those who will remain cautious whatever, those that never took any notice in the first place, and the middle group. And the middle group are probably the largest of all groups. All, regardless of what happens with regard to government recommendations and government measures, as I've said, we've got a very high baseline rate of circulating COVID. Most people will be mildly affected. Some will be poorly enough to be in hospital, and 1 or 2 deaths, but fortunately not many. But the very high rate of people being poorly will become an issue for primary care. It will become an issue for people being admitted to hospital, and that in itself will have indirect consequences because other care will be delayed. So I do think there's merit in a cautious approach to what we do next. Lots of talk in my inbox on masks. Should masks be mandated or should masks be not mandated? Well, you've heard what the Prime Minister has had to say. Mask wearing would not be mandated in lots of places, lots of settings of venues. I don't have the authority to mandate the use of masks, nor should I. What I will say is that a well-fitting 3-layer face mask has made a massive difference to transmission over the course of the pandemic, and this has shifted. This has shifted the transmission. It's probably shifted the case rate a little bit. It's not been a panacea by itself, but continuing to wear a face mask will protect you and others from transmission, and in itself, that enables the maximum number of people to go to work or school or any other activity that they're choosing to do. So for what it's worth, I will be continuing to wear a mask for probably some considerable time to come. Lastly, vaccines have and continue to have made a massive difference. If you've not yet had dose 1 and dose 2, please do so. If you've not yet had your booster, you are eligible, and please do so. You can pop along to the Moor Market, which is open 10 till 4 for the COVID vaccine. No appointment is needed, and it's never too late to get your first, second dose or booster, and there are plenty of opportunities across the city. More information is at the end of the video.